My name is Brian Holt. I'm the president and CEO of Hope Cancer Resources here in Springdale. But we are an organization that serves cancer patients here in Northwest Arkansas. We serve patients who either live in the four-county area of Washington, Benton, Madison, and Carroll counties, or are treated here. And we have the opportunity to serve almost 4,000 patients a year, obviously many of them from Fayetteville. And we are just really excited and honored to have received this award as Nonprofit of the Year from the Fayetteville Chamber of Commerce. And some of the things that we do, we have the opportunity to serve patients in a variety of ways. We provide financial assistance for patients. We can help pay for prescriptions. We can help pay for what we call emergency assistance, paying utility bills, making car payments, house payments, rent payments, whatever it may be when a financial burden has been created by the cancer. And in 2021, we are on pace to pay over $500,000 for the benefit of patients to help them through their cancer diagnosis and their treatment. In addition to that, we have 11 licensed social workers on staff, 5 of whom have a master's degree, and we are able to provide counseling services for those patients. We are able to provide that financial assistance. We are able to provide just day-to-day support for these people as they are going through their cancer treatments or even beyond their cancer treatments. So that's a significant way that we get to help people. We have a transportation program where we have 7 vehicles that run a 60-mile radius from the treatment clinics in Fayetteville and in Rogers. And so we go into southwest Missouri and northeast Oklahoma and even down into the River Valley, helping patients get to their treatments, helping them get to their appointments, and just providing that service. We will serve over 300 patients this year and drive close to 300,000 miles in transporting those patients. In 2020, we actually passed the 2 million mile mark as far as the service again that we've been able to provide for patients. In addition to those things, we have a Spanish medical interpreter who will serve and assist over 100 patients this year as they go for their treatments, as they go for their appointments. We are able to provide a wellness benefit to patients as well. We have a certified personal trainer on staff. We also have 2 certified tobacco treatment specialists on staff, so we can provide individualized exercise programs for people. We can provide tobacco cessation programs for patients, but also for the community and for people who are at risk of cancer. And with that program this year, we are going to serve probably 600 patients, in excess of 600 patients this year. And so there are a variety of ways, and one other actually is we have a prevention education program. And we have been, in the past, we have been into the Fayetteville schools. COVID is something that has limited our ability to do that, but we are reopening some of those things. And for example, in the past month, we were able to get in front of about 300 middle school patients in the Rogers public schools and talk to them about cancer awareness, cancer prevention, and different things like that. So we have a pretty robust, a pretty broad program of services that we can provide, not only to cancer patients, but also to their family members. For example, the counseling service that we provide, we can provide to patients, but sometimes the patient is not the one in need of that. Sometimes it's the spouse or the other family member who are providing support for that patient, and they need counseling, and we are able to provide that. And so one other thing with regard to all the services we provide, we are able to provide those services free of charge to any and everybody who needs them. So we have been a part, again, of this Northwest Arkansas community for about 12 years. And as Hope Cancer Resources, our history actually goes back much further than that, but this organization was established to help cancer patients in Northwest Arkansas, and that's what we get to do, and we get to do it in a lot of ways, and I've been fortunate to be here for all of that. We are extremely, again, thankful for the recognition that we're receiving from the Fayetteville Chamber. We love the opportunity to tell our story, and we hope to be here again for many, many years doing what it is that we do. I am very thankful to have been a part of Hope Cancer Resources for the past 12 years. And in that period of time, we have been engaged with our community. Obviously, we want to help make Northwest Arkansas a healthier community. And we can do that through our prevention education efforts. We do that, again, just by helping people through their cancer diagnosis and everything that means for them. I happen to be a Fayetteville native, and so what happens in this area is very near and dear to my heart, and has been for all of my life. And so the fact that we are able to contribute to, again, help make Northwest Arkansas a healthier place, and help people on their cancer journey as they're dealing with obstacles that they never wanted to be dealing with, that they never thought they would have to be dealing with. I just feel very fortunate to be a part of that. And I guess in a broader way too, I know that Northwest Arkansas Council, Larry Shackelford at Washington Regional, and the folks at Washington Regional, the folks at Mercy and Northwest, and all through Northwest Arkansas, are hoping to make Northwest Arkansas more of a destination point for medical care and for cancer care. So I'm happy that we can contribute, we can provide services to patients and services to providers that are really unique in our country here in the United States. And so whatever role we can play in helping make Northwest Arkansas more of a healthcare destination than it really is, we're just, again, fortunate to be a part of that, and I'm thankful to be a part of that as well.